Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and we are going to test the power of the muscles. Now we actually try to resist the patient's movement and make an idea how much power patient has got. It has got different grades, and the best is of course grade 5. Now again, like in neurology, all systems, we have to test both sides, and we have to test powers of proximal muscles as well as distal muscles, and we have to consider the overall physique of the patient. For example, this is a well-built young man, so my expectation of power should be accordingly. Now if there is an old woman, very frail, then of course I would expect less power, so accordingly the judgment should be made. Now let's start with the peripheral muscles. ये उंगलियां दबाइए, मेरी उंगलियां पूरे जोर से दबाएं, नहीं अंगूठा नहीं यूज़ करना, उंगलियां दबाइए, नहीं ऐसे दबानी, ये दबाए पूरा जोर. So I think when you are testing these distal muscles, you can give your fingers and ask the patient not to use the thumb, because sometimes patient has a lot of power, it can actually hurt your fingers. So this is how I do it. Basi. All right, bilkul perfect. So then I would test the power on the wrist. आपने मैं जो करूँगा आपने नहीं करने देना, नहीं आपने जोर ऑपोजिट लगाना, मैं जो करूँ आप हाँ अब absolutely normal. Of course, in true wrestling, and he would win, but we are just pretending I'm testing his power. So I'm unable to make any movement against his desire. अब इसको ऐसे करूँगा, आपने रोका, substitute norm. अब खोलूँगा, no, no, ठीक. This is a somewhat abbreviated system examination. The neurologist would actually test every muscle, but we simply test peripheral muscles versus proximal muscles and also both sides. Now let's test the power in the lower limbs. ऊपर उठाइए पूरा. So I think I'm unable to resist him. He still can, but he does get normal power again. Okay. Now when we test the other muscles, नीचे को दबाएं, पूरा. Okay. अब ये नीचे को दबाएं, पूरा, ऊपर को, पूरा, ऊपर. Okay. उठे ज़रा, आप उठे पूरा जोर लगा के. Okay. आप पीछे को लेटे ज़रा. Okay. So I have tested all the muscles, extremities, and also trunk muscles, flexors and extensors, and all are normal. So it's got normal power, which is grade 5. So you know the grades, there could be grade 0 power. That means the muscle limb is actually flaccid. That you can actually tell from inspection, it would be just flaccidly lying here. But if you ask the patient to make any movement, इसको करें, ऐसे इकट्ठा करें, हाँ जैसे, okay. So if he is unable to do it and there is no movement at all, you see there is not any flicker of movement on the muscle, that is 0. If you see just the flicker of movement, there is no actual movement, the flicker of the movement of the muscle, not the actual movement, that is grade 1, I believe. And if patient can move, eliminating gravity like this one, kare, yeah, this will be grade 2. Then against gravity, aise kare, okay. And then I think this one is grade 4, and there could be different subsets of, like there is minimal resistance, pura zor uthaiye, gravity, and then against resistance, and grade 5 is normal power. So you would again test one side with the other side, proximal with the distal, and also if patient has got your previous history with you, if you have maintained medical record, then you would also like to compare it with the previous one. So of course weakness could be, this motor weakness could be due to neurological disease or could be due to non-neurological disease, and other feature would tell you if this is neurological disease. And in neurological disease, you loss of power due to upper motor neuron or the lower motor neuron, and you will apply different features. And there are, I think I'll make another video to tell you how to differentiate between upper motor neuron lesion and the lower motor neuron lesion. So this was about the power of muscle. Thank you.